a new grad. I'm a newly licensed pharmacist from Southwestern Oklahoma State University. During my time at Southwestern, I was able to complete a mail order research project with some fellow students, as well as an advisor, over the exposure of mail order drugs to excessive temperatures, excessive considered by the United States Pharmacopoeia. And it's one of the regulating bodies as far as what drugs can be subject to during the shipping process, or even just in a pharmacy. That is then carried on by states when they regulate pharmacies. The standards are set in place for a reason. Every drug has a stability issue at some point. The temperatures we were looking at for USP guidelines in our research study, what is considered unsafe or excessive by our regulating bodies. The guidelines recommend that excessive temperatures of over 90 degrees Fahrenheit, your non-cold chain drugs like your tablets, capsules that aren't temperature sensitive don't have to be necessarily kept in the refrigerator. Those can be stored at like 68 to 77 degrees Fahrenheit, so anything considered room temperature. And that's what we go by in the pharmacy. And for refrigerated cold chain items, those are to be stored at 36 degrees to 46 degrees Fahrenheit. So that is all logged. It's in the regulation that we log those daily. But what is so perplexing about the mail order pharmacy realm is the responsibility of the medication once it leaves the pharmacy. So the mail order pharmacy would claim that it leaves the pharmacy when it's in the carrier's hand. But then they put that responsibility immediately on the patient. If they picked it up immediately, no problem. It wasn't sitting outside, it wasn't sitting in a hot mailbox. Well, that's not what our study looked at. We logged the temperature every 5 minutes from when we dropped it off at the carrier and it was priority shipped. So we shipped out to 10 different locations varying from about 50 miles to 1,300 miles. This was during the summer, so our limited resources, everyone was on vacation. And so we shipped them to those areas, which was actually a pretty similar representation of how far packages are shipped via mail order. While it was a small viability study, 80% of our packages, cold chain and non-cold chain, they reach temperatures considered excessive or unsafe by the FDA or the USP, the numbers I mentioned earlier.